Here we're going to do a brief review of thigh anatomy. Here we are starting off with an anterior view of the thigh. You can see the rectus femoris muscle, which overlies the vastus lateralis and medialis muscles. Here's the lateral aspect of the thigh, and we just removed the rectus femoris muscle. And here we can see the underlying vastus intermedius muscle, and we also removed the vastus medialis and lateralis muscles. You can see the overlying ITB band, which overlies the vastus lateralis muscle. Going across the thigh, almost in a diagonal, is the sartorius muscle, which we just removed here, and that kind of acts as a shield over the femoral artery and vein. Also, you can appreciate the saphenous nerve as well that runs along the medial thigh. Also, here you can appreciate the adductor hiatus, where you can see the femoral artery and vein passing through, forming the popliteal artery and vein. And now we're rotating towards the medial thigh, where you can see the gracilis muscle, as well as the semitendinosus muscle and the semimembranosus muscle. And deep to the semimembranosus muscle is the adductor Magnus muscle. Here's the back of the thigh, and again you can appreciate the popliteal artery vein, as well as the sciatic nerve, which splits into the tibial nerve and the common peroneal nerve. Here we're removing some more layers. You can appreciate the gastrocnemius muscles and also the plantaris muscle, which is superior to the lateral gastroc muscle. Also, you can appreciate the posterior femoral cutaneous nerve over the posterior medial thigh. And now we're again looking at the lateral thigh. We just removed the ITB band, and we're kind of focusing here on the knee. And you can appreciate the genicular arteries and veins that essentially surround the knee, and they originate from the popliteal artery and veins, and they go anteriorly to converge around the patella. Here's also a view of the common peroneal nerve that splits into the deep peroneal nerve and the superficial peroneal nerve, and also the saphenous nerve, which is a superficial nerve on the medial thigh. It supplies cutaneous sensation to the anterior knee as the infrapatellar branches. Here's again the medial thigh. We can see the thick semimembranosus muscle that is superficial to the adductor Magnus muscle. Also, you can appreciate some of the pelvic musculature as well that form the pelvic floor. And now we're just left with some of the adductor muscles, including the adductor longus and pectineus muscles. You can appreciate the sacral plexus as well, which is quite complicated. And you can also appreciate the femoral nerve as well as the lateral femoral cutaneous nerve. The underlying muscles have been removed, but at least you can see the course of those nerves, as well as the saphenous nerve, which you can see here feeding the infrapatellar branch.